Our short-term goals for Susie were, by the end of the shift, to provide smoking cessation resources, to meet with a dietitian and cardiologist to discuss lifestyle changes, and prior to discharge to lower her blood pressure from 145 over 90 millimeters of mercury to 135 over 90 millimeters of mercury with the use of metoprolol, which is a beta blocker, and to decrease her chest pain to 0 out of 10 during activity with the use of Tylenol. Our long-term goals for Susie were to maintain an exercise routine of 150 minutes of moderate intensity exercise per week, as well as to maintain DASH diet regulations, smoking cessation within 8 to 10 weeks using Nicoderm patches, for Susie to lose 60 pounds at a rate of 5 pounds a month, with a weight loss goal of 175 pounds 1 year from discharge, with further weight loss encouraged, and lastly, to lower her blood pressure from stage 2 to an elevated range, which ranges between 120 and 129 for systolic and less than 80 for diastolic millimeters per mercury within 5 months.
For our interventions, we're going to administer medications like diuretics and beta blockers to help with hypertension. We're also going to administer acetaminophen to help with chest pain. We're also going to educate Susie on smoking cessation, administering her medication, and complying with medication. We're also going to collaborate with cardiologists and dietitians. We are also going to provide Susie with nicotine patches during her hospitalization, monitor for any changes in her pulse, blood pressure, respiratory rate, and temperature, and we're also going to check labs like CBC, cardiac markers, ABG, and electrolytes like potassium and sodium that can affect the heart.
When evaluating Susie, she met all of her goals. She reported 0 out of 10 pain, was able to state back her knowledge of the importance of lifestyle changes such as quitting smoking, and reported a decrease in her feeling of fatigue. When taking her vitals again, blood pressure decreased to 134 over 88. Her heart rate was 80 beats per minute. She had a respiratory rate of 20 and an oxygen level of 98%. Susie expressed her knowledge of nicotine patches as a form of nicotine replacement therapy.
For long-term evaluation, we meet Susie after about 1 year. She's made great progress overcoming hypertension by getting her blood pressure down to 129 over 85 and getting herself to a healthier weight and BMI. She's also stopped smoking and has decreased her alcohol intake. In terms of dietary changes, she's been maintaining a low-salt diet, keeping her cholesterol down, and making sure to exercise at a moderate intensity for around 2.5 hours per week. Susie's long-term goals have been met.